Imbento lang!
Welcome to Invento Lang, the show where we delve into the minds of Filipino innovators who have left an indelible mark in science and technology. I'm your host, Steve, and today we have the privilege of talking to none other than Dr. Reena Estuar. Dr. Maria Regina Justina Estuar, or Doc Reena, is a professor at the Ateneo de Manila University, the Department of Information Systems and Computer Science, or DISCS. In 2022, she was honored by the Philippine Senate through the Outstanding Women in the Nation's Service, or TOWNS, for her work in the field of computer science and social psychology, specifically on her efforts in developing computing platforms for social good. Dr. Reena is recognized for her work in the Ateneo Center for Computing Competency and Research, BluEHR, tugon.ph, and the Feasibility Analysis on Syndromic Surveillance using Spatio Temporal Epidemiological Modeler, or FASSTER. Join us as we uncover the stories of Filipino inventors. This is Imbento Lang. Stay tuned for a conversation with Doc Reena. Hello, Doc Reena. Welcome to the show. And we're so happy to have you here and for joining us today.
Thank you, Steve.
Let's talk about you as an innovator. Could you tell us more about yourself, the center you're affiliated with, and how did these projects came about?
Okay, so I'm housed at the Department of Information Systems and Computer Science. It is also the home of the Ateneo Center for Computing Competency and Research, which was formerly called Ateneo Java Wireless Competency Center. So I wear several hats, but for this particular discussion, we'll talk about the center. The center started in 2003 with a vision of having a place where the research and development will reach its full potential, which basically means it's adopted by a particular group or it is transformed into a business unit, right? It's the center started in 2003 under Dr. Luis Sarmienta, who was a graduate of MIT. So when he came home, he won an award, and I think Smart Communications provided funding together with funding also from Ateneo to establish that R&D center. The vision and the mission has not changed. The vision and the mission, the end product is you provide a venue for faculty to extend their knowledge and put it into practice without going out, right? So it's industry inside Ateneo. At the same time, polish, potential for commercialization of several applications that are being developed by the students and by the faculty. So because it has been a long time since 2003, one of the first products of the center is the value-added service. So way back in 2003, we had Java phones and people would download like games, right, or ringtones. So that platform was built at the center, and that was the one that generated income from the center. So, and that model became a model for several other projects that we developed, which was a framework-based model, something that you can reuse for any particular need. No? So it's not tailored just for a particular market, but it's something generic enough that we call it reskin, okay? And moving forward, when I took over as executive director, I realized that we were moving away from the research component. It was all about business. The center was earning. We were able to pay back Ateneo the loan, the startup fund that was given to the center. But it was all about business. There was no research publication. And so when I entered, I focused on doing that. No, so right now we have less of the business side. We have more of the research side. Yeah.
Let's talk about you've been cited by the Philippine Senate for your various works because of the Towns Award, and they've linked and affiliated you with that one. Could you tell us more about these projects and how they came about?
Yeah. So when I became executive director in 2007, I said we need a purpose for the development of the software. That's why I always emphasize that it's a software for social good. So there has to be a conscientious effort and purposive effort of in having that intention of developing a platform for a particular group, and hopefully it's for inclusivity. No, it's not just for a niche, but it's for the general public. No?
Right.
There are several. At the time of Father Ben, the priority areas were education, health, and disaster. So that was the focus. Let's build software technologies. Then was mobile platform for health, for disaster, and for education. But maybe a significant year would be 2012. When SMART developed Shine, which is an electronic medical record that was supposed to be deployed to communities because there was a need to digitize electronic medical records towards the universal healthcare law. There's a need to digitize our health records because obviously when there's a occasion where we need to know the health status of a particular community, maybe in terms of prioritizing interventions such as vaccination,
Sure.
right? If we don't have data, then the distribution of these resources might not be correct or optimal. But aside from that, also would be the need to digitize the health records for us to be able to maybe appreciate the benefits of PhilHealth, right? Because for most of us, for example, we only know that when we're not feeling well, we go straight to the private clinics and the hospitals. None of us, or very few of us, go to our health centers when in fact we should, right? That's our primary care, and a lot of things are free there, but that's not part of our general approach to healthcare.
Unfortunately.
Yeah, but if our health records are digitized, we actually have to select a primary care facility, and that's the starting point of maybe being more conscious of our health. No? But more than that, no, it's really for the general public, no, the rural health facilities, because there is a need actually to have a way of maybe submitting the health records in a more efficient way so that we have good data at the national level, maybe at the regional level also. That's one. There was a need to digitize health records. So that's the reason why there's that Shine platform, which SMART donated to Ateneo in 2013. But I think the formal start of the work was 2014.
Right.
Yeah. By 2019, the funding ended, and we had more than 5,000 health records, and we didn't have money anymore, but it was on the cloud, so we were paying for cloud service. So the decision was to spin it off to a commercial entity, so that the income from the commercial side will fund the communities. So that's where it is right now. So that's BluEHR for most of you would be familiar with it, with BluePass. So the BluePass is the skin that we used for the Ateneo side, but for our commercial users it's BluEHR. For the rural health units it's BluRHU. So you have different flavors of this platform. Again, we follow the same discipline of it being a framework, something that we reskin. No? So even the way the software was built, we can just plug in any new module based on the needs of our users. Yeah.
That's wonderful. Can you describe to us the moments or series of moments that led you to your initial ideas? I would assume that, the Shine platform wasn't the final, or didn't wasn't the initial prototype that you had or the initial idea. How did you manage to kind of like make sure that the need fitted what you were proposing?
That has been a challenge, and it still is, no, because the again software changes every time there's a new technology,
Right.
and every time there's a new need. That's why even the design of the software should accommodate these changes, no. So in particular yung Shine, it's module based. So, for example, if one community needs a dental module,
Sure.
we build a dental module on top of it. And then if one needs an annual physical exam module, if one needs a Blue Pass module, so we build on top of it. So that's the idea in software. One is to design it so that we can reuse certain components.
Mhm.
That's one. So the idea of the Shine platform is that it's a network technology. You know, it's not just a software. It's something that can share. You can share the health records, because the idea is, anywhere I am, ideally, if I give consent to the person to access my records, that person or that can access it because it's connected. So another purpose of the digitalization of the records is so that it's universal. So if I go to clinic A and then I go to clinic B, if I give permission, then they can access it. No? So I have easy access to my health records. So it's a network platform for health. And the other products that we have the same design. So another one is the 𝗚𝘂𝗲𝘀 platform. That one was used for disaster. It was also eventually in partnership with Project Agos of Rappler. And the last one, which is the more popular one and the recent one, is the FASSTER platform. Again, all of them are social networking platforms. For 𝗚𝘂𝗲𝘀, it was a crowdsourcing platform. You can report any type of disaster, right? And then the agency will receive it, and they would know the status. There's validation. The FASSTER platform is a shared platform for modelers. So you can initial design was you can upload your models, and then it can be viewed and can be used for maybe projecting cases. Yeah.
And in contrast to the Shine, I reckon FASSTER has been donated to the government.
Yeah. So Shine was a donation from Smart to Ateneo. But again, no, the donation is essentially just the code, which over time has changed.
Right.
No? So we just carry on the name, right? But for software, there's no like schematic diagram or like an architecture that you can say it's patented, it's mine. No, it's just versions and versions. That's why it's so hard to like patent a software. See, Shine became Blue Pass or BluEHR, right? The 𝗚𝘂𝗲𝘀, it was also we had a spin-off company for that. It's called Transform. So its logo is X. It's supposed to be transforming lives. So I remember we had all of the platforms that were built from the center had logos. It was very important that we had an idea of the branding. So even the company name, so Tantum Quantum Technologies, of course, because of the word Tantum Quantum, so it's sakto lang. No? I mean, when people ask me, ano ibig sabihin ng Tantum Quantum? The easiest way is sakto lang, not too much, not too little, basta sakto lang.
Very
we designed the technology for its real need, being able to adjust the technology based on the maybe a dynamic environment where the technology is used. So si Shine naging Tantum Quantum, BluEHR. Si 𝗚𝘂𝗲𝘀, we killed the product.
Oh.
Yeah. So at that time, with Project Agos, it was okay. We were piggybacking on Rappler's maybe promotion.
Mm-hmm.
We were the back end actually. So we had the Agos platform and then pinasok namin si Bayanihan inside for the validation, verification, and modeling. So parang naging ganun yung purpose ni Bayanihan, more on the modeling side, verifying if the reports are correct. And then, bago siya ibigay sa agencies. Kasi yun yung hesitation ng mga government agencies. How do we know if what you're telling us is real? So there has to be a validation process. For example, disaster management. Maraming nagsasabi na baha na dito. How do you know that it's real, right?
Right.
So, dati ano yun, digital infantry ang tawag, no? Meron kang isang room na maraming tao nagtatawag-tawag dyan, totoo bang may baha dyan, ganyan-ganyan. So we facilitated that with a platform. So nag-transform si Ibayanihan into that. No? After some time, hindi na parang uso yung, may disaster pa rin, may mga bagyo, pero parang hindi na siya uso. Nagkaroon ng need for a platform to monitor gender-based violence. Then sabi ko, pwede ito. So, binibenta mo siya eh. Alam mo, pwede ito. Tapos alam ko na sasabihin ng mga programmers ko, ayan na naman si Reena. Binibenta na naman yan. Pwede ito kasi gano'n naman siya, crowdsourcing report. Pwedeng ang nagre-report ay ang victim or ang witness, di ba? I-report niya through SMS. Tapos, so, an NGO actually used that for several years, no? So, they were collecting reports on violence, gender-based violence in different communities, and it was a simple database of reports and how they responded and the status. I think it was very helpful for them. But after some time, nawalan sila ng funding.
Mm-hmm.
So nawalan kami ng kaisa-isang customer. Okay? So ang problem ko kasi is I listen and I always say yes, no, to my bosses. So when they said, spin off mo yan, sige, spin off natin. Tapos parang, okay, ngayon na spin off na, paano na? Diba? So yung business aspect, hindi naman ako trained in business. So I had to learn that, no? I had to learn how to deal with BIR, how to deal with SEC, no? Which we should also teach our students, no? When we tell them, be innovators and be entrepreneurs, yung reality niya, nahaharapin nyo yung mga kailangan na isubmit sa SEC, you have to submit reports every year, and so on and so forth, ganyan, even with BIR, ay mga ganyan. So anyway, I had to learn all those things, and I'm still struggling hanggang ngayon on the business side. But on the product side, yun yung parang inspirational. Kasi we are able to pivot. So I call it a pivot. So right now, the product is not there anymore, but the company is. And the vision of the company is to transform lives, right?
Mm-hmm.
And because it was registered as a software company, we are able to now develop new technologies. So right now, we are working on, and I had to, for my own wellness, I guess, balance it with the other things that I do in my lab, no? So one of them is really natural language processing and AI. So right now, Transform, which houses Ibayanihan and Tugon, is now a computational linguistics AI company. Yeah, so where we are now with a group where we are developing still for transformation of lives, language models for the Filipino.
Wow.
So ang vision nito is hindi kailangan mag-English ng ordinaryong Filipino pag in 10 years from now may kausap na siya na technology. Kasi that's the purpose of all this AI eh.
Mm-hmm.
So now you're using ChatGPT to generate more information that will help you understand things, right? But eventually, these AI will be placed in devices, right? And hindi malayong hindi mangyari na at some point may kausap ka na robot, right? So ang gusto natin is Transform will make sure that yung kausap ng ordinaryong Pilipino that person is comfortable.
Yeah.
Kausap niya sa language na alam niya at makukuha niya yung kailangan niya from that one. We're not making it general. I want it domain specific. So again, these large language models are very general, but I think the approach should be domain specific. So sa health, diba? If you want people to be more conscious about their health, just ask something, tapos magbibigay siya ng information in the most parang simplest form. So health is one that we're focusing right now kasi dun yung siguro yung maraming information namin. So that's where Transform is right now. And of course, si FASSTER, iba naman yun. It was designed 2016. It was a proposal actually by different groups. Let's develop nga a surveillance platform where the data is coming from different sources. Tapos, meron siyang portion na models that will help project para early detection of possible pandemic or possible transmission of diseases. No?
So even before the COVID pandemic,
yeah.
the technology was there?
Yes, 2016. It started in 2016 and then pinilot namin siya sa Iloilo. Pero yun talaga, blank canvas yun. Parang I just said yes. Like, okay, maganda yan. Tapos sabi ko, sige, so iba't ibang sources ng data, but we need to partner with people. You can't build technology for your community without understanding who your stakeholders are, no? So a lot of the effort was really on that, no? More than the technical part, it was really establishing good relationships with people that you'll be working with for a long period of time. So one of them was IBM Technologies because sa kanila nanggaling yung portion ng software ng modeling.
Okay.
So ang problem doon sa software na yun is hindi siya cloud-based. So our goal was to make it cloud-based. Another group was ASMPH through then former secretary and then Dean Manalet Dairit. No, kasi we said we can't have this platform without an epidemiologist and a public health expert on board, right? Because we're just the tech part. And then we also had to get the nod of DOH because sila yung magde-deploy nito, sa kanila namin to ibibigay, di ba? So those were the three groups. I think that some of the innovations would be, aside from it just being a reporting platform for disease, we wanted it to be a platform for early detection. So ibig sabihin nito, meron siyang passive surveillance. We call it syndromic surveillance. So at the symptoms level pa lang, dapat namomonitor na. Hindi yung dahil positive ka na. So at the symptoms level pa lang, so sabi ko, pwede i-connect si Shine. Kasi si Shine, dyan nire-report yung symptoms. Di ba? Pagka pupunta ka sa clinic, anong nararamdaman mo? So kung sa isang lugar, maraming nagre-report na may ubo, may sipon, andito si surveillance, kasi iba't ibang unit sila eh. Nakikita niya, bakit dito sa lugar na to parang lahat nagre-report ng may lagnat? Anong meron dyan, no? So parang yun yung idea. Hindi naman namin alam na mangyayari yun, no? So it was just a proposal. There were a lot of skeptics,
Sure.
It was like selling an idea and then convincing funding agencies, hey, this will work. So anong disease ba yung gusto nyo? So at the time, it was dengue, measles, and typhoid. So we practiced by doing that. Then I said, paano naman yung pasyente na hindi pumupunta sa clinic? Yung nasa bahay ka lang, tapos masama yung pakiramdam mo. Bigyan sila ng SMS module para pwede ako mag-report ng may sipon ako. Papasok dun sa EMR. Tapos papasok dun sa surveillance. So parang ganun. So lumaki ng lumaki. Tapos yun si Tanod COVID. That it ended with Tanod COVID and FASSTER during the pandemic. So yun yung story naman ni FASSTER. So iba-iba pare-pareho yung pinanggalingan nila. So it's a computing platform that will collect data that can be used by a lot of people, where you can share information, validate information. But then it branched out to different products, and it will continue to branch out to different products in the future. Yeah.
Thanks for sharing your experience on that, Doc. I'm very curious on how you were able to get these partners, these stakeholders, collaborators on board. What was like their tipping point or the selling point for them?
So yung electronic medical record, talagang nagdo-door-to-door kami sa mga communities. And that was part of the funding of SMART. Actually, we would go to rural health communities, parang binaybay namin ng lahat ng barangay ng Iloilo, lahat ng barangay ng Cebu, kasi yun yung mga communities nila. And we also had our own communities. One of the parang sad stories then was, I wanted sana Ateneo to adopt it. But at the time, the institution was not ready to adopt technologies. So we searched for other users na lang, no? So we reached out to the communities. Tapos binibenta talaga siya. Tinuturuan namin yung mga doktor gumamit. Tapos sasabihin ng doktor, ayoko kasi nagtatype. Pag may pasyente ako, nakakailang sa pasyente yung nagtatype si Doc. So, pwede bang nagsasalita ako tapos nire-record? So, nandun na naman siya sa listahan ko ng, sige. Or, kasi dito iPad ang ginagamit ko, pwede bang sinusulat ko siya tapos nire-record dyan? Okay. So, nanganak yun ng products, no? So, may mga pangalan yun. Meron kami si Stephen, kasi si Stephen yung student na gumawa nun, pero it's really a Shine text to speech something, or speech to text product. So we have prototypes. We have ang daming prototypes na hindi talaga natuloy. No, pero nandyan siya, nabuo yung idea, nagawa ng sample, and then nandyan lang siya.
So through talking to these actual users, though, the features nag-a-add
have
siya.
improved. Yeah.
So the final product is totally different from your initial
So you
prototype.
cannot say that it's just yours, no? You can say that you started with it, or it was like an idea of one person, or maybe one group or one company. Specifically for SMART, it was for their CSR, right? Actually, originally business yun parang business unit. Then they realized, walang pera. Gawin natin siya CSR. Tapos dahil CSR siya, lipat natin siya sa academic institution. So pati sila nag-innovate, no, on where they will place the product so that it can last, no. So from our end naman, ganun din. Ano ba dito ang pwede natin idagdag? So the word invento, right?
Yeah.
I think mas grounded siya if you know kung para kanino mo siya binibuild, no? And then mas maganda kung kausap mo talaga yung tao na yon. So I'd like to highlight that, because I realized that iba yung vision ng funder, iba yung vision ng doktor, pero iba yung need ng nurse or ng encoder na siyang gagamit, no? So lahat yun kailangan mo i-accommodate, no? Para saan ito kailangan ng doktor? Para saan ito kailangan ng DOH? Para saan ito kailangan ng encoder? At lahat yun dapat ilagay mo dun sa software. So, yun. Yeah, that's why I'm saying the technical side is not really the hard part. It's really the community. Understanding their needs, at the same time, being there at the right place and the right time. No? Kasi hindi naman siya in-embrace kaagad Etong tatlo, hindi. Nagkaroon lang, in particular, nagkaroon ng mga policies Parang antayin mo na maging requirement siya. For the electronic medical record, naging requirement Wala nang choice.
Yeah.
Kailangan. Hindi accredit ang isang facility kung wala kang electronic medical record. Yes. After 10 years, hindi na tayo kailangan magbenta. So sila yung biglang tumatawag sa amin, Doc, pwede pa ba namin gamitin yan? So, ganyan na. So, baliktad na yung story, no? Doon naman sa Ibayanihan, alam niyo, ay nangyari, no? So, ako na yung nag-pivot noon. So, parang totally different na siya. But, I want the vision, the transforming lives to remain, no? Yun, si FASSTER, yun yung, I guess, pinaka-recent natin na maganda rin yung story. Kasi it was ending na in 2019. Now, idodonate ko siya na feeling ko hindi siya gagamitin. Kasi parang kailangan pa ng maybe another few years according to the final evaluation of DOH for it to be adopted. Problem with donating technologies to government, in particular yung sa atin, is yung challenge sa kanila, oh fine Reena, idodonate mo yan. You have a team of 20. We don't have a team of 20. How will we maintain that? Diba? So parang at that time, I was very young and innocent and didn't have answers to those, no? So I didn't know na ito palang mga binibuild ko, kailangan ko ng forever hanapan ng funding. Kasi hindi mo na siya pwedeng i-kill kasi nga may users na siya. No? So, isa yon. With FASSTER, limbo siya. That was 2019 ng December. 2020, nag-start yung pandemic. Tapos nun, because naka-on yung prototype niya, punta ako sa PCHRD. Sabi ko, kita niyo marami nagre-report ng may sipon, ganyan. Tapos yun, lumabas na yung pandemic. Tinawagan kami, can you form a team? In a week's time, I formed the team. We wrote the proposal. It was approved kasi hindi ka pwedeng gumalaw ng walang funding. And you were there, right? And then in a month's time, we launched the FASSTER platform, learning from all the mistakes that we made during the 3 years prior to the pandemic. So parang ready na siya to address the pandemic after 1 month.
There was a bit of luck into it, though.
Yeah, oo. Swerte, oo. Yun lang yung na-highlight, no? Pero yung journey to how it started and because it was donated and fully adopted and where it is now is
the uncertainty that you had.
At saka tuloy-tuloy na story yan. Oh.
For sure.
Different chapters.
Thank you, Doc, for sharing those. And for listeners who might be on their brink of creative discovery, just like you experienced before, or perhaps they are frustrated in that nothing is happening with their inventions or innovations, what may you advise to them?
Yeah, so again, no, so for those who know me, I rarely say no kasi, no? And that also means I rarely say no to my ideas, no? So number one, like people have to parang remind me, tama na. Kasi pag sinabi, pwede bang dagdagan ng ganito? Pwede. Pwede bang ganito? Pwede rin naman. So, because it's really pwede. It depends on, do you have funding or do you want to do it or pa-prioritize mo pa siya. Again, iba ito sa mga hardware technologies, no, or other like inventions like devices, no. This is software. I can say yes because you can just build another module, right? I'm not saying it's easy, no. So just continue being creative. Never close your mind to all the possibilities that are out there. When you have an idea, so ako in the lab, and my students know this. We allow students to write on the walls, on the glass portions, glass portions of the lab and the whiteboard, and then if it turns out to be a research, it stays there until the student graduates, and then it is erased after graduation. So parang nandun yun yung idea kasi magbabago yun magdi-discuss hanggang mabuo siya into a final product. Which is a thesis or a software, ganyan. So again, siguro, even the craziest idea, I think okay lang, isulat lang. Have a notebook or a place where you write down all these things. I don't erase anything kasi I want to see where it started and then where it is now, no? It's hard now because we have so many other products, no? And then you go back kasi Very important sa akin saan nga nagsimula at ano yung dahilan. You get lost along the way. There are so many temptations. That's why I added a motto sa lab code with a heart, no?
Oh.
Code with a heart. Kasi with the technologies now, you need to teach our software developers ethics, proper use of that the software that you will build can transform lives. And you have to make sure you're aware of, let's say, the limitations of the software, the danger of the software, and build protections internally. No? So sample na lang how these social computing platforms or social networking platforms changed us, changed our behavior, di ba? So parang, where's the ethics behind that? No? Hindi conscious yun noon.
Mhm.
But now that we know the potential of these technologies, I think it's our role also as advisors to have those components in a part of the design of the software, no? So being ethically aware. So it's polite computing.
Yeah.
Polite computing, ethical computing as components of these technologies.
I'm so glad that this is being brought up now, especially now that in an era of misinformation and abuse. And
Right. And AI.
yes.
And AI, because we don't have, so it's just starting, the consciousness is not just starting. We don't even have like strict policies. So for example, in discs, we already changed the academic integrity policy that students need to declare any use of these technologies and for what reason they used it, no? Because it's hard na to know Ako pa ba yung nagsulat nito? Kung karamihan nito, kinuha ko from, let's say, ChatGPT or any other open AI technology. There's no clear, when you code, there's an AI. In Zoom, there's an AI. In your Google, in your email, there's an AI that can summarize, no? So parang, saan pa ako dito? And there has to be that clear, conscious awareness. This is still mine, no? So even with the creative process, that's why it's important for me, you write it down, no?
Mhm.
Yeah, and then maybe, I guess, in the future, change the way we maybe assess the students, no? Ako, ginagawa ko yung baseline I know, I need to know how they write, so they write by hand. I know their baseline, the way
Wow.
they write. So when they submit, 'di ba? So parang may conscious effort ka rin na para alam mo talaga kung sila yung gumagawa. But yeah. So in general, never say no to your ideas, even if it's crazy, even if it's
How
impossible.
wacky it may be.
Yeah, oo. May paraan yan para maging totoo. But I guess what I'd like to leave out there is, at least for the lab and for the students who work with us, it's really important that it's not just for any sake. It has to be for improvement and transformation of lives. And there's a conscious effort that the technology you build is for good.
What's next for Doc Reena? Could you tell us more about your upcoming projects or any developments?
Yeah, so yun na nga. So I'm still managing the same product, if you can call it a product, but it is transforming day by day, no? So on the management side lang, which is again a reality when you invent something, no? Is you need to make sure that you can sustain your team. That's one. So in different ways, getting grants, looking for partners, pivoting your product so that maybe a business sector will pay for that one, which will pay for ganon. So that's, and I always write it down, no? So at home I have that glass board again, just trying to connect everything that I do, aligning it with these three products that we need to maintain. Kasi I cannot distract myself anymore. But on the polite computing side and coding side, my dream really is to set up a foundation, code with a heart, meaning the children, I will open up, let's say, a summer camp, and parang live-in summer camp where I will teach them coding for social good, na conscious sila. Kasi sila na yung future scientists, sila na yung future generation where we will have more challenging technologies. No? So mas maganda na plant mo na sa kanila, this ethics, the ethics and the purpose of technologies.
That was Dr. Reena Estuar. Thank you very much, Dr. Reena, for gracing us with your presence today.
You're welcome. Thank you also.